I've assessed her and I know that she's an immediate. But I've gotta leave, I've got the bleeding stopped, so she's stable as far as I'm concerned. I'm gonna lift one leg up. I'm gonna lift one arm up. I'm gonna bring this arm up and over, and I actually put it on their cheek.
Now she's looking like Raggedy Ann.
I trust her.
Okay, but then I've gotta come over to this
Yes,
side,
and pull.
and
yeah.
I've gotta pull her over.
Just grab onto my
I'm gonna-
waistband or
can you
yeah,
help me?
yeah. Yes, I will. I didn't really. You did it.
Pretty light.
It's not. I was just gonna say it's not that hard.
Okay.
Sorry.
For me, I'm always worried that I'm gonna lose control of their body, that the spine is gonna be twisted or something's gonna happen. So I'm more concerned about that. This is called recovery position. At this point, I also would put a blanket on her.
Right. Cover me up. But look at where my mouth and nose are, so that she's leaving me behind. If I'm drooling, vomiting, you know what I mean. My mouth isn't gonna end up in a pool of that. It sounds terrible, but that's. Yeah.
But you're not gonna.
But
She's just leaving me. I mean, she's
She's
covering
not
me
in
up
shock.
to treat for shock. She's leaving
She's
me
not in shock.
behind. But at least I stand a chance now to kind of breathe on my own and not suffocate.
Yeah,
Is
she's
there
in
any one
recovery
side?
position.
Is there any one side that's
Nope.
preferable to the
No,
other?
it's going to depend on where they're located. Like if I was up against a wall or you know what I mean. It depends upon them. But this does help as you pull over.
Because they were teaching us in CPR that you would prefer the left side, especially with pregnant women, for instance, because otherwise you cut off the flow of blood to the fetus and stuff. So
Well,
Wow.
I think that's a special consideration.
Yeah, I
I'm
do
glad you
too.
brought that up.
I've not heard that.
Because that would be a consideration that you'd have to make, and you might have to, if you can't move them that particular way, you might have to pull them away
Mhm.
to get the room to move them. But I'd like you to practice these two things. One is
Yep.
pretend that you've got a cut on your forearm, and you're gonna